Two British people with severe allergies apparently had reactions to Pfizer-BioNTech's COVID-19 vaccine, raising questions about whether it's safe for people with pre-existing allergies.
So let's get the facts. Joining us on the KOGO News Live line, Dr. Al Johnson. And when we're talking about allergies, what are we talking about, hay fever or something else?
In this case, we're talking about something else.
Okay, what was it?
Well, what appeared to happen in these people, from the reports that I read, is that 2 or 4 people had a Bell's palsy type reaction where you get facial weakness, and that implies that something has been reactivated probably with the vaccine. We know when you get the vaccine, it activates your immune system, and part of that can be affecting prior infected areas. So we don't know whether these people had prior Bell's palsy or had other conditions. They seem to be reported as being allergic, but we see that people come down with Bell's palsy normally when they're under stress or have another infection. So this could have been something that was reactivated that they already had or activated in the normal sequence, but with the extra stimulation of the vaccine, they had these symptoms and adverse reaction to it.
So Bell's palsy clears itself up after a number of weeks. Would this happen in this case, or we don't know?
We don't know because it hasn't played out yet. But the way the reports are, it appears that they would clear up. So we just have to wait and see. That's why people that are more prone to reactions probably would be wise to see how these cases play out. In medicine, we use protein substances for many things, like IV gamma globulin. People do have reactions to proteins. And so we just have to be careful. It's expected, and part of the whole treatment sequence. It's not like an anaphylactic reaction where you eat shrimp and your throat closes up, or you have severe asthma. This is more of an inflammatory type response, which is an exaggerated response because the vaccine already does stimulate the immune system.
So that's interesting because one of the things that COVID-19 does is sort of spur your body into an exaggerated inflammatory response, which is what causes all that lung damage, from what I'm understanding.
Yes, that's correct. So your body responds in many, many different ways to insults that we have each day. And one of those is the inflammatory activation process that the actual COVID forms. The side effects reported from the vaccine is like fatigue is one of the main ones. Sometimes some joint pains and aches, just those normal type inflammatory responses that are some of the mild side effects. And in these people that may be harboring a virus in that facial nerve, it could have just stimulated. And that's supposition. We don't know yet, but I've seen that happen with other patients that we treat on a normal basis.
So I think a lot of people, they go to the extreme and they're like, can a vaccine kill me or leave me with lasting health problems? I mean, how would you answer either one of those questions?
Well, most likely not. It'd be really, really rare, at least from the data that's out there so far. So, and the studies, most of them have been done on non-allergic type people. Those people who have had reactions to like injections, or if they've been taking gamma globulin, which they're an immune compromised person and had adverse reaction to it, yes, they need to be careful and aware and make sure that they ask the appropriate questions about how will this affect me. But overall, it seems that there is quite a bit of safety that has been looked into in these and studied on numerous patients. And they've kept the the major allergic items out of the vaccines. They were preservative-free, and they have no egg. And so prior vaccines, people that were egg sensitive and some of them that had chemical preservative problems with reactions, that's not present either.
Okay.
That's a step in the right direction.
All right, Dr. Al Johnson, thank you so much for your time. We appreciate it.
Oh, you're welcome. Have a healthy day.